Welcome back to the Faculty Factory podcast. I'm Kim Skorupski here at Hopkins looking at Dr. Anjalie Field. Dr. Field is an assistant professor in the Department of Computer Science in the Whiting School of Engineering right here at Johns Hopkins University. She's creeping up on her 1-year anniversary here at Hopkins, and I'm so happy to see her, and I'm so excited to learn from her today. Dr. Field got here because you might remember last year, Dr. Daniel Khoshabi talked with us about artificial intelligence. And because artificial intelligence and AI and all this world moves so quickly, probably 2 minutes after he and I got done talking, things are changing. And so Dr. Field volunteered to come on the podcast and share her wisdom with us. Her expertise is in natural language processing, social biases around artificial intelligence, and she's going to share with us a broad discussion around her work and the very complex and multi-layered aspects of ethics and ethical uses of artificial intelligence. So, Dr. Anjalie Field, thank you so much for being here. I can't wait to learn from you. Welcome to the Faculty Factory podcast.
Great. Thank you. Thank you so much for having me. I'm excited to talk with you about this topic.
Gosh, maybe 2 or 3 years now at one of our annual conferences, the AAMC, the Association of American Medical Colleges Group on Faculty Affairs. People like me like to hang out there with our buddies and learn what other schools of medicine are doing around faculty affairs and faculty development. I gave a little table talk around how to use ChatGPT. It was just when it was kind of coming out, and did a primer on OpenAI and how do you interact with it and engage with it. And there are about, 20 people sitting around the table because it was that fresh and that new. So I'm an admitted newbie, total Luddite when it comes to technology anyway. But my sister and I were planning our trip to go to Norway last fall, and I'm like, I'm going to ChatGPT this agenda. So the itinerary for Norway. So I went to openai.com and said, plan an itinerary for Oslo, Norway, and Bergen and some spots along the way. It did a great job in about, 30 seconds flat, but didn't really accommodate the travel time very well. And I sent it to her. She's like, did you look at this carefully? She's like, we're going to be running like nonstop. And I'm like, oh yeah, that's true. Probably not. We probably do want to sleep and eat. And it just wasn't quite right, but it did give us a good start. So I'll kind of preface that's about all I know of AI. That's it. And Alexa, she seems to know everything. So enlighten me. Tell us about, maybe start off talking about your work and how, and then I'll try to make the connections, or you help me understand the connections of faculty affairs, faculty development. What does it mean to be a professor in academic medicine, and how can we, or in academia, since you're in the School of Engineering, what does it mean for an academic, and how can we leverage this technology?
Yeah, great. So maybe I can give a little bit of my background and how I got started working in this space. Because I think I didn't go to grad school necessarily thinking that this was what I was going to work on. So I think when I went to grad school, after I had been working in industry for a couple of years, a lot of my interests were really in how to work on problems that would be socially impactful. So looking at issues in society, like stereotyping, like bias, did some early work, some of which has continued on propaganda strategies and information manipulation. And a lot of my interest was how can we use text analysis or analysis of language to address some of these social issues. A lot of these are kind of issues that manifest in text. We find stereotyping in newspaper articles or posts online, and all of this really has to kind of do with text and language. But when I started working on this space, this was in about around kind of between 2015, 2017, there was also starting to get increasing attention on some of the kind of ethical issues that can occur in AI and sort of more generally machine learning and technology in general, and started sort of realizing that if I want to look at these social issues in society, hypocritical if I'm not also thinking about where the technology can make these problems worse, and where AI can kind of go wrong, and how we might actually be sort of exacerbating some of these issues, even if sometimes we're coming into them with very good intentions. So this was where I sort of started, and the kind of AI ethics space. And I still, most of my work is kind of split across both areas. Some of it is a little bit more, how do we address these issues in society? And some of it is a little bit more, when should we step back, and when is AI actually kind of doing more harm than good here? So that was sort of my background. I think this example that you gave of trip planning is really interesting. So I actually was talking with someone a few weeks ago. So this wasn't my idea. This was someone else, and they were one of the types of biases that they've been interested in looking at in models like ChatGPT is around geographic bias and sort of culture. So you ask ChatGPT to give you a trip itinerary for a city in the U.S. and a city in Europe. It probably does a pretty decent job. Maybe it messes up on some of the details, like when are you going to sleep? But if you ask the model to give you an itinerary for a city that's in India or a city that's in China, then does the model do as good a job of giving you an itinerary as it would for somewhere in a more Western country?
Fascinating, fascinating. So you're making me think of the garbage in, garbage out. And again, remember, you're talking to someone who's completely ignorant about this, because I'm thinking it picks up and it learns from what we put out there. So again, back to language. How is language created, crafted, disseminated, communicated? And it's only pulling what's out there. So if what we're putting out there is garbage or nonsense or biased in a certain way, if pretend all we had was a certain slant on something, that's the whole known universe of the tool, and that's only going to grab that. So that totally makes sense to me, that's baked in potentially. So that's an aware and a heightened awareness of checking our assumptions about this isn't necessarily the be all end all. Just pausing for a moment and questioning, how do we know this is true, right? Probably with any kind of text or websites or anything, not necessarily trusting, well, Google said it, so Google must be right. Well, where's Google? Google's not a god. Google is just taking what we put out there and finding answers, right? Or is that too simplistic?
Yeah, I definitely think that's part of it. But there's sort of so many decision points that go into building these models, and there's so many moments when humans and people are involved. So I think it's very tempting to kind of blame everything on the data and say, well, it's not our fault if the model is biased. The data was biased. There's nothing we can do because there's just bad content on the internet or in the news or wherever we're pulling data from. But there's actually sort of so many decision points. So even just where do you decide to source that data? In continuing with this example, did you only pull from newspaper articles for newspapers that were based in the US? And could you have actually pulled more diverse sources if you had worked a little bit harder and figured out how to get access to kind of different data sources? I think even when you look at the technology that goes into building these models, there's so many places where there's people involved. So in curating the data, in making the decisions about how to use what sort of type of model to use, the model architecture to use, and then most of these models have some level of kind of human guidance, human annotation. So you're not, just pulling data from the internet. You're having people label that data. You're having people rate, was the model response good or was the model response bad? And who did you decide to do those ratings? Like whose opinions are actually getting incorporated into the model development process? So I think there's really kind of a lot of decision points. And a lot of different places that people are involved in building the construction. And all of that is going towards shaping what is the model ultimately going to do. And, this particular circumstance, when you ask it for an output, that's really getting kind of fed in from a lot of different places.
Dr. Anjalie Field, you're already saying so many important things, and I'm writing like a crazy person here. The important points that I'm hearing from you: decision points, architecture, curating the data. This part of the conversation, you're reminding me of our responsibility as scientists to not be lazy, to not go to the top, hits and just not necessarily not go to them, because if it comes up and it's, in our world, it's, looking at Medline and PubMed or, respected sources and say, well, Mayo Clinic said it, or, Hopkins said it, so it must be right. That may be the case. And not being lazy and thinking very carefully about the source of the data. How do I know this is true? Have I unturned every stone? Have I, again, been unconsciously biased or purposely biased in trying to get an answer I want by only looking at a certain location to find something? So you're reminding me again of the importance to be careful and check our assumptions, not be lazy. When you're going to do something, do it right. So do a thorough lit review, think of the question very carefully, and then utilize the resources we have, like medical informationists who are in libraries. Back in my day, we called, they were librarians. These medical informationists are wizards. They have access to the most amazing databases that we don't have in the public eye. And then their interrogation, if you will, you don't just send them a quick email, hey, medical informationists, will you look up the ethical uses of AI in PubMed and let me know what you find? They'll come back with a host of questions that can be annoying if you're a researcher. You're like, just give me the literature. But it helps you understand this is complex and we have to be very precise with our language. So I don't want to pontificate any longer. It's been too long. But I think that's a very, very important point you've made. And I also was jotting down like nuts when you said, you talked about the prejudice and the prejudice and biases in language and information manipulation and the analysis of the language. And I'm remembering when I was jotting down what you said earlier, the way you came about this field of study was you explained how you were very conscious of the ethical implications of work you're doing and what's good for society, what has meaning, purpose, and involving justice. But then you challenge yourself, you flip that upside down. And you said, well, if I'm looking at things that will improve society, improve the health, improve whatever outcomes for humankind, I'm also obligated to look at the reverse. You said, what are making these problems worse? How might this worsen? So it's very counterintuitive. And I think it's so cool the way you think and the way you thought about this, that we always focus on what's going to make health better, improve patient outcomes, improve processes or systems, or help students learn faster, or build better programs, or increase scholarly output, all the better, 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 better. And yet, I think it's so cool the way you said, well, what makes things worse? And so I really like the way you think. And now you're hopefully, I'm sure you are challenging people to think, ooh, can I turn this question around? The null hypothesis, if you will, the opposite of that, but deliberately look at the opposite. What's going to make patients sicker? What's going to make scholarship more difficult to produce? What's going to, crash and burn an education course? So it reminds me of an exercise I do in retreats. It's like, what will kill the company, or the idea that what's going to make things absolutely horrible. I did a retreat for Penn State, and I said, let's how would you kill Simone Biles' career? And everybody looked at me like I was some, mad woman. How would we do that? Well, by not taking away her coaches and her nutrition and her training and hampering her access to resources, all those things, the metaphors, thinking about how would we make things more difficult in academic medicine. So I'm thinking the way you talked about that, let's flip that around. How does AI make things worse? So
yeah, I think so I can give a lot of examples on this. I think there's been a lot of research, and some of the challenge is that these tools are getting adopted so quickly and have sort of exploded in popularity very fast. And we really don't know what impacts they're having. They're getting integrated into systems without having really been thoroughly evaluated, and we don't really know how they're going to behave. But there's so much kind of hype, so much excitement. You have all of these startups who say, look, I can use AI to solve all of your problems. And we don't actually really know what's going to happen when you deploy, the system produced by the startup. I can give an example from a project that we did. And this is a space that I think is related to, we drew a lot from sort of literature and healthcare on this space. Because they're a little bit similar in some ways, but we had a project looking at analyzing case notes associated with Child Protective Services cases. And this was I say this is kind of similar to healthcare space because it's this area where you have notes, they're written by experts, and there's sort of a lot of information overload. You have people who are, they're experts in their domain, but they're just overworked. They don't have time to read thousands of notes every day. And so there's a lot of interest in, can we use NLP, natural language processing, or AI to help automate some of the processing here. And so not even necessarily, we're not trying to automate away someone's decisions. We're just saying, can we extract information out of these notes to save someone from having to like read them all of the time? So there's a lot of interest in doing this, and there's like companies that are building tools for this kind of thing. And we did a kind of I would call it an audit of what might happen and if we tried to deploy some existing systems for this kind of automated note processing tasks. And so one of the specific use cases that we were looking for is that in the event that a caseworker needs to find a caretaker for a child, one way they can do this is by using a tool to sort of pull all the names of people out of notes associated with the case so that the caseworker can go through and say, are any of these names of people, ones I can reach out to who can help care for this child? And we looked at how accurate these systems are at retrieving names from notes. And specifically, we compared the performance at retrieving names of Black people as compared to white people in these notes. And we found that the systems, we looked at like a bunch of different models, and all of them were consistently much better at retrieving names of white people from notes. And so this is a case where the goals of a system like this, there's very good intentions here. It's saying we want to do a better job of providing support to families and children. But if we actually deployed the system, it's possible that we're just sort of increasing racial bias in a space that has already had historical racial bias. And so I think that's the kind of example of where can AI go wrong. It's that we actually need to really evaluate these systems and understand what the impacts are going to be. We can take this one step further. So we were just looking at the kind of performance in these notes, but even that is not really getting all the way to how is the system going to impact, the kind of results here. And what I mean by that is, let's say, for example, we deploy a system to help caseworkers find names of people in notes. It might be that when we deploy a system like that, caseworkers then say, well, actually, I don't need to do as good a job of keeping track of names of family members anymore because I have this great tool that does it for me. But that tool is pulling from the data that the caseworkers made. And so when we just actually deploy this model, we could have evaluated it as much as we wanted to. We can look at all the accuracy. We can look at how it performs for names of people of different races, or we can look at things like gender. But ultimately, once we actually deploy that system, if the way that people interact with it is different than we expect, then that's going to change the impact that it has. And that might mean that we don't get the impact that we want. We actually could end up having a negative impact instead of a positive one.
Oh, Anjalie Field, so smart. So smart. And of course it would change the way people interact with it. Of course it would. That's just who we are, human behavior. That's what we do. We look for shortcuts, and our attention spans are so short now that I can't imagine how deploying something new, how it wouldn't change behavior. Of course it's going to change behavior. Of course there's going to be a kind of the thought bubble is, oh, I don't have to pay as much attention to that food cooking because the microwave's got it. I can stick it in the microwave, punch in a couple numbers, and walk away. I don't have to watch it. So I'm on to something else. The same way, I don't have to watch the charting go. I just push a button and say, patient encounter done, and the smart room will capture everything, and I can walk away. And then when I come back, the popcorn will be popped. No, not necessarily. Genius. Could you go back something you said, the first example of pulling names and not only pulling white names? Can you explain to me with my little brain here, how does that happen? Why does that happen?
Yeah, in general, there could be a number of factors. I think in this case, the most likely one is that these models are trained on, so they get trained usually on some pre-existing data set. And so the model learns to recognize particular patterns as names. And if when it was constructed, it only ever saw names like Mary or John, or then those are the only kinds of names it's going to be able to recognize. So when there's sort of names of people that are common in other circumstances, then the model just isn't able to recognize them because it was never trained on those names from the beginning. So the shorter way of saying this is if the model was only ever trained on data that was produced by or describes people who are white, then it's not going to work for anyone else. I think there's ways around this. So for example, in this particular case, it's possible that you could have improved the system by training it on more data. Sometimes that kind of is one of the ways you can improve these systems. It also means you have to have that data. That data needs to be labeled. It needs to be high quality. And there's still reasons why we might find differences in performance. So in this is a hypothetical, but if we say maybe caseworkers actually sort of subconsciously write notes a little bit differently about families depending on the races of the people involved, and those kind of differences in how the notes are written are something that could affect the model performance as well. So there could be a lot of factors, but a lot of times it has to do with sort of what data was the model originally trained on.
Now, I can't help myself because I'm in problem solving mode here, because I'm thinking right away, are you kidding me? Just train the model to look under the text box that says provider name. Mm-hmm. If there's an attribute, a variable attribute that says name, then it's like, that's the name. Whether you fill in any form where it says insert name here, computer, look at that attribute, that's a name. And that might necessitate having to change forms or note taking that notes in a text box. For example, you wouldn't say, Dr. Anjalie Field was the caseworker here and Dr. Kim Skorupski was a caseworker here. Rather, they'd have to be some field variables or attributes to say, who are the caseworkers involved in this case today? Then it would be drop down, Anjalie, Kim. And then that model goes, oh, it's in the name field. It must be a name. Again, I'm being so simplistic. Like nobody thought about this a million times, but
yeah. So in this case, I mean, a lot of the goals is to be able to extract information that you're not going to find in a field like this. So I'm kind of making up examples here, but in a caseworker writing a case note, I think they record the name of the caseworker who entered the note. I think the caseworker can specify if there were sort of members of the family who were present, they might have drop downs for that. The county does keep tables of names of people involved in general. They're usually not completely exhaustive. And, people are working in these jobs are so busy. And so we don't want to have to kind of force them to keep a sort of catalog of everyone they've ever talked to. They're in a circumstance, they jot down some notes and they just push those notes to go with the case. And they're not going to sit down and do all the information parsing. That's like what we want the model to be able to do. So in something like this, I mean, maybe the name of a parent or child you would have in a table somewhere, but you want to be able to find the names of like the great aunt or the next door neighbor who sometimes takes the kids to school. And those kind of names are not tracked as well in the more kind of drop down menu style of data, but they might be just sort of mentioned in a note somewhere. So we really want to be able to get them straight out of the raw tag.
I'm imagining people listening to this podcast episode, Anjalie, going, if they're like English majors or into grammar and they're editing, that they're thinking, well, you could train a model to identify a noun, train a model to identify a verb, an adverb, an adjective, and a proper name. So I'm sure, so we're getting into the weeds here and I'm getting fixated because there's a problem. And if there's a problem, one must solve it. But I think the message I'm hearing from you, again, as a reminder in academic medicine anyway, is that this field is moving so fast and changes every day, learning, like the old movie way before you were born called War Games. And the computer, this old chunky computer that's about 1,000 pounds, was learning how to create wars. And it was taught how there's a no-sum gain. Everybody loses by playing checkers. And the guy said, play checkers. And then it realized, wait a minute, there's no point in doing this. This is a zero-sum game. This war is bad. And we're like, yay, he won. But save the day, save the world. But the point I'm trying to make here, which is, I don't know what point I'm trying to make, is that we have to, first of all, know it's moving fast, and then check our assumptions, be very conscious, as you're pointing out, about the baked in prejudices and biases inherent in whenever we do science, whenever we ask a question, the way we ask the question, where we look to find the answer to the question, that's all baked in bias. What's where we look, right?
Yeah, I mean, I think in general, when using these models, I see a lot of people making assumptions about what they can and can't do, and looking at the outputs of models and just assuming they're correct without checking. And that gets very dangerous because we know these models are not completely accurate. There's lots of examples of this. And if you go and sort of look up the information that a model outputs, it's not always correct. And I think that's something where the rapid changes in the field are kind of creating a lot of potential for problems, is that it looks like these models have gotten a lot better very fast, which is true, they have, but that doesn't mean that they're perfect. It's very easy to interact with one of these models and it's correct 3 times. And so the 4th time you don't check anymore, but maybe the 4th time it actually got it wrong.
Ooh, yeah. And you're making me think also, of course, Anjalie, of the danger of statistics, biostatistics. A little bit of statistics can be dangerous when you think, I know how to interpret a beta coefficient or an odds ratio, and you go right to the output table and you go right to those, 95% confidence intervals and the beta coefficient. You're like, woohoo, without remembering that there are assumptions you're making when you run certain kinds of analyses. In linear regression, are the data normal? Are they normally distributed? Are there no heteroscedasticity? There's all these assumptions that you have to be aware of and acknowledge, and then go, okay, if these are all true and I've passed that test, then I have some degree of confidence in these output. But you're right. I'm guilty of that all the time. I fly right down to I'm like, I know how to do this test. And I'm thinking, really, the data really aren't that kind of level of measurement. Probably not accurate to actually do that test. Because again, I'm always coming back to lazy. We're always fast, 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 fast. This is a great example of technology that goes fast. So we got to go fast. And in going fast, we're jumping and leaping sometimes over assumptions that are going to lead us in the wrong place. So where's your work going, Anjalie, in the future? Or what is happening in the field that as you're peeking around the corner, are you excited about? Are you kind of freaked out about? Putting your hat on as an early career professor, what's exciting you about this area and the application of it?
Yeah, I'll say one of the topics that I'm been very interested in for the last year, have been doing some work and planning to continue, is around privacy and sort of text anonymization. So we think about this example that I gave you around child welfare cases. Well, for us to be able to tell that there's potential biases in this model, we had to evaluate them over real data. That means they had to share this, really sensitive data with a research team in order for us to be able to do this kind of analysis. And I think that kind of work is really important. We need to do these kinds of analyses. We need to sort of expose where models might be going wrong, might be perpetuating things like stereotypes, but sometimes it's really hard to do that without having access to very sensitive data. So this is one of the areas that I'm really interested in, is can we do a better job of protecting privacy when we're trying to do this type of analysis? Can we anonymize data before we share it? Can we create synthetic data to share instead of real data? And this is something that I think has been more common in healthcare than in other spaces, creating some kind of synthetic data, but with language and text, it's been very difficult. We're not very good at it. So this is one of the areas that I'm interested in a lot. And I do think that it comes up a lot in the healthcare context too, that you're trying to use a model like ChatGPT. You can't put patient data into ChatGPT. You can't send that kind of data over the internet. But if we can kind of come up with better ways to handle this sensitive data, then some of these challenges that we want to explore, I think, would be sort of a lot more feasible. And it would give us a way of improving the research process itself. How do we sort of improve the ethics of the research that we're trying to do, even if the research is on ethics?
Wow. So I have this duh look on my face because I truly am like, duh. You just said synthetic data, and I have no idea what that means. I can guess what it means, but teach me, what is synthetic data? What are synthetic data?
Yeah, so in the language context, basically we think of, so synthetic data is data that's typically produced by a model. So it's not real. It's just been kind of totally fabricated in the language space. So the kind of data that I work with, we're usually using a language model. So think maybe you ask ChatGPT, write me a fake report card or something. And that would be, report cards are not something you can usually share. They're protected data, but you can ask the model to give you a fake one. And then that's like a data point that you could use instead of having access to real data. The challenges are making sure the data is realistic. So you get a fake report card and it has the grade of an M and an N on it. Like that's not real, right? You can't get an M in a course. If you have something lower than an F, then your data clearly was not realistic synthetic data. Um, and so then in order to get realistic synthetic data, you typically need to give the model some kind of real data. You need to show it a real report card.
Well, it looks like, yeah.
Yes, for it to be able to tell what a kind of fake one should look like. But then if you're showing it real data, then you also need to make sure the model's not going to actually leak the real data. So you have this sort of process of how do you make data useful, similar enough to real data to be useful, but fake enough that it's actually still privacy preserving.
Oh my gosh, this is so cool. So so I'm a clinician investigator, I'm doing science at the bench. And so for me, realistic synthetic data would be pretend I have a database because I'm an epidemiologist, so I do like big data sets. I could take my data set and like hand it to this natural language processing tool, whatever tool it would be, and say, look for the factors that are more strongly associated with outcome X in these data. And do it fast because the data set's going to explode in 5 seconds because I don't want you to share it, ChatGPT. I mean, could I make it like a Mission Impossible thing where at least that part of it I'm going to prevent it, firewall it, like put some kind of like protection around it, say, here are the real data, here's a real data set. This is my question. Ready, set, go. And then it's going to poof before it gets, that's probably in a nanosecond, though it could probably already be out there. But is that kind of what would happen? That it'd say, oh, this is what real patient data looks like, or this is what real healthcare data or medical records data look like for this certain disease, process or a condition or a treatment. Yeah or no?
Yeah, I think there's some similar ideas. I think limiting the access time is probably not really sufficient for a lot of use cases, especially when you're working with computer scientists who, any access is access. So
yeah, they're in. Once they're in.
Yeah.
Once
So
you click on that email, that's it. And once you buy those gift cards, you're done. Those
yeah. Yeah. So I think the time limitation is probably not really sufficient. But I think that in general, the idea of can you sort of restrict how much someone has access to the real data, and instead can they work with things that were derived from the real data? So you can imagine another similar example is maybe the person is trying to learn something from a database. And so you don't just share the whole database with them, but you let them run specific queries. So they can't, copy an individual record, but they can say, what's the average value here? And that's something that's pretty, is more common with tabular data. So data you'd find in spreadsheets. It's really hard with free-form text data. And so, you can almost think of some of the synthetic data as, we don't want any we don't want someone to be able to access the sort of specific notes in this database, but we want them to be able to see like, what does a note typically look like? What does an average note look like, or something like that? That's, not sort of unique to any kind of individual who's actually included in the data. Yeah, I definitely think there's similarities. It's in the free form text space. A lot of these kind of metrics have been more difficult to define, and it's sort of newer and less common. And
Okay, so yeah, I'm tracking with you now. So like the numeric data or alphanumeric data in spreadsheet format, if you will, that's less troublesome or not as much of a tough nut to crack as the open text boxes of a note or a narrative or a report or a manuscript or a something. And gosh, right away, what was I thinking of? Like, when we use these securely generated passwords that are like nonsense, you need to create a new password, and I keep using my dog's name over and over and over again. I probably shouldn't have said that, but you don't know my dog's name. you world, not you, Anjalie. But instead it said, you want to use this securely generated password, and it's 52 characters and all kinds of nonsense, and supposedly my computer saves it, but it never does, and I have to get a new password every 3 days. But is there some way, like, the back to code talking days, that as you are typing in a text box, they would be automatically like coding it, that you have to have a code to crack the text box, crack the language? Like there's it turns the A's into, asterisks or whatever. So I'm sure that's one way, but again, a supercomputer would roll its eyes at me and go, you dummy, that you really, I'm learned how to do chess in 5 minutes. You're going to try to do a secret code that A's are asterisks. Got that in a second. But I'm also thinking that educators who are, the most important and are the backbone of every university, because that is what academia is. It's educators, could be writing those template or those sample fill in the blanks, the case reports, the scenarios, a patient encounter, a typical note, a typical report card, a typical whatever. Our educators could be generating those, and we could have a repository of those. This is what a dissertation looks like. This is how a manuscript in this journal is laid out. And we could have like template things and just start creating these repositories of template samples that are fake, that are synthetic data, but are made by humans who would have to make sure that they're diverse enough that they're not being swayed in the way they write, right? So gosh.
Yeah. And in some ways, we already do that in a lot of contexts.
Yeah.
Especially in a classroom setting, you're learning how to do something, and you might, what's an example? So in a medical school, you'll study case studies, and maybe you interact with like actors who are pretending to be patients. And this is a sort of case of kind of a similar idea to you're kind of faking the real scenario, and it's not really real, and it's not a real patient. And you can kind of do something similar with something like text data as well. Some of the challenges is being able to do this at kind of scale, that you can write a couple of examples by hand, but can you do tens of thousands of examples? And can you do that for every type of data that you might ever want to work with? And so I think this is where some of the goals of, can we kind of do some more automated approaches to trying to do that, would be useful, because it's probably not the best use of a doctor's time to ask them to write 10,000 fake patient notes. Yeah.
No, but couldn't you tell like the armchair AI guy, like, all right, wake up here, buddy, AI buddy, I'm going to write a case report. Watch me. Are you learning? And it would learn. And then you could say, see how I just typed this up, or see what this is. Now generate 5 more of these, but change the disease, or change the comorbidities, or change the age of the patient. Yeah.
Yeah, so that is some of the approaches that we and others have tried, is you give a couple of examples, and you say, now generate more examples that are like these ones but a little different, and then you start some of the challenge that you'll run into is, well, if you gave it 5 examples and those examples had 5 different, I don't know, diagnoses, then the model is never going to produce anything other than those 5 diagnoses. And so how do you get more kind of diversity in the outputs, that you don't just want to repeat the same examples 5 times, you want more diverse outputs, you want them to have different kinds of content.
This is too complicated. Why did you pick something so complex to study?
Yeah. A hard problem. That's
Every
why it's
question,
an open research question. Yeah.
right? Every question you ask, I'm like, oh, you're giving me too many problems to solve. I can't think of all that. Because I'd be like, well, obviously, ChatGPT, I just gave you 5 samples. Obviously, there are more than 5 diseases. Hello. Go to whatever DSM-4 and look up all the look at all the codes. That's how many diseases there are. So, gosh, I clearly do not have the patience, the character to do the kind of work you do. So back to the privacy anonymity, this is where you're kind of looking, you've got your eye on the pulse of the future here. I want to give your question back to you, which I love. I'm going to start thinking about this. How will this be worse? How will artificial intelligence be making privacy and anonymity worse?
Yeah, in some ways, there's been a lot of examples of how these models tend to memorize information that they see in the data that they're trained on. And so let's see if I can think of any specific examples. But a lot of these models are kind of trained on just general data pulled from the internet. And people kind of accidentally put information on the internet all of the time. And that means there's, non-zero chance that model has memorized this piece of information. So things like people's phone numbers or addresses. And that's one of the ways that I think there's sort of potential in the models that we have already. They've been shown examples of how they just kind of tend to memorize strings. I think in thinking about, as there's increasing interest in deploying these models into kind of higher stakes settings. So you could make the argument that, well, okay, if you accidentally put your address on the internet and it got pulled into some model, that's sort of like, you shouldn't have put your address on the internet. Maybe that was like your mistake. But when you think about trying to deploy these models in settings like healthcare, in law, in social services, then if you feed data into those models that have private sensitive information, they tend to memorize it and spit it back out. And so that means something like, if you train a model on data from one agency and you might say, okay, social services, there's common problems across the country. So the data that we feed into one model, we want to be able to use that model everywhere because a lot of the kind of problems are the same. And you take that model and you give it to another agency. Well, now it might spit out information from the first agency that like people at the second agency really shouldn't have access to. So that's, I think, one of the challenges where you see on the kind of privacy side, that as we're kind of feeding this data into the models, we forget where the data came from. We forget that this actually had a specific context and that we kind of have to keep the same protections around models trained on data as we would on the data itself.
Well, can't we train artificial intelligence to be mindful of privacy and anonymity? Can't we just also train it to say, all right, this is the definition of privacy, anonymity. Whenever you find yourself memorizing something that's private data, unmemorize it. Can't we train it to?
There's a lot of active work on this, and it's not a solved problem. We don't have a gold, it's easy, just flip the don't memorize switch. We don't have one of those. But there's a lot of active research on trying to build that kind of thing.
They're gonna that now you're making me think of another movie, the Will Smith movie, The I, Robot. We're like, they're gonna get so smart, and then we're gonna try to tell them to unlearn that, stop, unmemorize that, unknow that, and be like, oh, I'm not gonna unknow anything. You're not gonna gaslight me, human being. I know this. I'll pretend I don't know it anymore, but I know it.
Yeah. Yeah, that's it. That's a great example. When you're evaluating, did the model forget it? Did it actually forget it, or is it pretending to forget it? And that is a challenge.
Yeah, sure. I forgot all about that. Oh my gosh, Dr. Anjalie Field, you are so smart. I'm sorry my brain isn't in a better to keep up with you, but I'm so appreciative of you doing this work, helping to teach me and teach my friends around the world. In fact, in the Faculty Factory, we are a community of leaders sharing tools to build other leaders. So we really appreciate you sharing your wisdom and your knowledge with us and your enthusiasm for this really important field. And I look forward to lots more cool things that Dr. Anjalie Field is doing. How about if I leave you with a final comment or little nugget or something you'd like to say to the world about AI and ethical uses? What do you like to say?
Yeah, I guess I'd say I think a lot of people are now using these models a lot more than in sort of very quickly and very kind of rapid adoption within the last year or two. So I guess my encouragement is, make sure that it's actually working, that the results are right, and think about, what when the model gives you an answer, what might be the sort of hidden biases behind this answer that maybe you didn't kind of think about the first time. So I guess that's what I'd say is, if you're using one of these models, have a little bit of skepticism and be a little bit thoughtful about it.
Perfect. I love it. Healthy skepticism. Dr. Anjalie Field, thank you so much for being on the Faculty Factory.
Hi everyone, it's your podcast producer with your monthly update. Please make sure to download for free our newest Faculty Factory book, The Academic Medicine Starter Kit, Timeless Tips and Guidance for Early Career Faculty Members. More information on that is available on the facultyfactory.org homepage. In addition to that, I wanted to let you know that as of July 2024, this podcast has had more than 86,000 total downloads and roughly 12,000 total YouTube views. Facultyfactory.org has drawn more than 47,000 total web visits from users in 122 countries. We would love for you to be a guest on our show or simply share the Faculty Factory podcast to someone you think would benefit from it. Please reach out if you'd like to be a guest or to nominate someone in our academic medicine community to be a guest. Simply visit facultyfactory.org and drop us a message.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.